Welcome, everyone. Good afternoon y buenas tardes. Thank you so much for joining us today. As we discuss, we have this clinical research webinar hosted by Equitable Breakthroughs in Medicine's Development and Building Trust Through Innovation and Inclusion in the Hispanic Community. I'm your moderator today. My name is Yvonne Rodriguez, and I'm with NHHF. With me, I have Dr. Daisy Morales-Campos from UT Health Houston School of Public Health, and Dr. Jesus Saucedo from Trust. As a note for housekeeping, I'd like to ask all participants to basically your microphones will be muted, but feel free to type questions into the Q&A box for panelists. We will have a Q&A session at the end of their presentations. Also, please feel free to fill out a short post-survey webinar survey. This will be emailed out after the event, and it's also going to be shown as a QR code. Recording will be housed at NHHF website and will be sent out 1 week after the event. Next slide. The National Hispanic Health Foundation has a mission to transform the healthcare system through leadership, research, and education to increase Hispanic health equity. To learn more about us, feel free to scan the QR code below. And for any meetings with Dr. Rios, please contact Jennifer Zelaya. Her email is located below as well. Here we have, at NHHF, we have the National Hispanic Health Research, and our mission here is to elevate the participation of Hispanic physicians, researchers, and other health professionals that are in clinical research. With the steadfast focus on advancing research and education, the center is poised to lead transformative initiatives that promote health and well-being of Hispanics across the nation. For awareness, we have Hispanic principal investigators, we have a clinical researchers database, and we also have a Hispanic medical student database. For education, we host webinars such as this one, toolkits, and mentorship. For more information, please visit www.nhhfx.org. So I will begin by telling you a little bit about our sponsor today. We're hosted by EBQ Med, and EBQ Med is a collaborative partnership to diversify the participation of clinical trials with communities of color and rural communities by increasing awareness, addressing misinformation and historical mistrust, and ensuring that trials are easily accessible. EBQ Med is working with local communities and clinical trial sites to support their aspirations for sustainability and equitability, providing clinical trials for their patient base. We do have, EBQ Med has an ecosystem of network partners. Currently, they're coordinating an initiative of mentoring local learning phase at the clinical trial sites, and they're responsible for the overall management and governance of EBQ Med. These include Yale School of Medicine, Morehouse School of Medicine, the Research Center in Minority Institutions Coordinating Center at Morehouse School of Medicine, and Vanderbilt University Medical Center. For the ecosystem for EBQ Med, there are 3 crucial components of this to drive the goals. 1, we'll start with the partners. Operational, community-based, and faith-based and professional support sites in building capabilities and capacity to drive diverse community engagement and robust clinical trials. Sites and communities. In partnership with communities, this ensures that research is aligned with community-identified priorities and needs for better patient outcomes. And last but not least, we have sponsors that collaborate with sites to shape clinical protocols for more inclusive research and host trials that align with community priorities. The objectives for today's webinar is using the Promotora model to increase recruitment of more Latino clinical trials, We hope that you take away that participants will learn culturally appropriate research strategies to recruit sufficient Latino patients for clinical trials that are focused on the Promotora model, the importance of clinical trials in improving Hispanic health outcomes, and leveraging technology to bridge language barriers and enhance patient engagement in clinical trials. And without further ado, I would like to introduce Dr. Daisy Morales-Campos, Associate Professor at UT Health Houston School of Public Health.
Good afternoon, everyone. Buenas tardes. I would like to thank Dr. Rios and the National Hispanic Health Foundation for inviting me to share my research with you all today. My talk today is titled Investigating Multi-Level Implementation Strategies in Federally Qualified Health Centers. So I will be providing a brief overview of the pilot work that led to the funding for an R01 clinical trial that's focused on improving vaccination rates for Latina adolescents in Texas, and provide a brief update on where we are currently with the clinical trial. Next slide, please. So the Entre Familia pilot study focused on increasing HPV vaccination among adolescent patients using theory and evidence-based strategies in 2 Texas federally qualified health centers. These centers were located in South Texas, as you can see from the map. One was located along the Texas-Mexico border and one further up south. And both these centers served predominantly Latino adolescents and were located in areas with high cervical cancer incidence rates for Latinas. Next slide. So this slide describes both the implementation strategies used by the practice facilitator and the training modules for providers and immunization navigators that the practice facilitator conducted as part of the pilot study. As part of the pilot, I just wanted to note that the health centers selected who their immunization navigators would be. Some selected health educators, while others used promotoras as part of as the leads to help navigate the patients. So as you can see, the pre-implementation work focused on conducting a baseline assessment, which consisted of self-administered provider surveys, observations and practices to create flow charts for each practice based on observational notes, and then the collection of electronic health record vaccination data for the adolescents to get initiation and completion rates. The practice facilitator then presented a summary report, including all the aforementioned data to the leadership at each federally qualified health center and the healthcare providers that we worked with. Then the facilitator conducted separate education and training for the healthcare providers and immunization navigators. And then they eventually created what we call a clinical practice plan to make improvements in the practice based on the data that was presented to the health centers. Next, please. So here we present data from the 9 practice sites that completed all the required modules. So you can see that the length of the modules averaged 30 and 60 minutes and ranged 14 to 55 minutes. Healthcare providers in our pilot found these lengths acceptable and set aside time to complete the modules. The individual modules were essential for facilitators to develop rapport with the healthcare provider and also learn more about their unique circumstances at each practice. This included like their patient pool, what experiences they had, any particular needs at the practice, and also work with the FQHC leadership to make practice changes. And I just want to note that this was conducted prior to COVID, so I know now it's a little bit different, and I'll discuss that a little bit when I talk about the R01. Next slide, please. So in this side, you see one of our immunization navigators, and I just wanted to point her out. This is Yvonne. She was one of the promotoras from FQHCB, and you can see her providing health education to some of the ladies at one of the sessions. The immunization navigator outcome data showed the following. In FQHCA, the navigators cumulatively served 914 unique HPV vaccine eligible patients through individual brief education and client reminder recalls, and educated almost 3,000 county residents using an evidence-based group education curriculum. That's the one you see in the picture. In FQHCB, the navigators provided 4,556 services to HPV vaccine eligible patients. They scheduled close to 850 vaccination appointments for our FQHC, and they educated also close to 3,000 county residents through both individual and group education. Next slide, please. So this slide shows the results when we're looking at the electronic health record, the vaccination rates. So you can see that combining both provider and practice level strategies using a practice facilitator over a 2-year implementation period, HPV vaccine initiation more than quadrupled. It went from 4 to 19% in FQHCA and increased from 45 to 66% in FQHCB. We also saw that missed opportunities to vaccinate, and that just means like if an adolescent came in for a different reason into the clinic and they didn't catch that they weren't up to date with vaccinations. It also decreased from 14% to 0% in FQHCA and from 36 to 0% in FQHCB. So these preliminary data that I'm showing suggest that practice facilitation is a feasible approach for building the capacity of predominantly Latino serving FQHCs to select and implement provider and practice level strategies aimed at increasing vaccination rates. So now to talk about my current research, based on the data I just presented, I was awarded an R01. So this, in the R1, we are testing implementation in 3 different federally qualified centers in Texas. And as you can see in the map, we moved from South Texas and now we're focusing in El Paso, Galveston, and Brazoria, and Harris counties. And we're hoping to see if this multi-level intervention that I described with the pilot study improves vaccination rates, if it increases the number of providers recommending the vaccine, and increases parental confidence in getting their children vaccinated. Next slide. So currently for the R01, we're in the planning phase. We're working with the first health center that's in our grant, which is a community health network, and we're working on coordinating and implementing baseline assessments. So one major priority in my research centers on establishing collaborations with community partners and co-creating research priorities and projects. So true synergy, which is what we're calling the intervention, emphasizes community building and develop rapport and trust between the research team and with FQHC leadership, their healthcare providers, and their staff. You can see in this slide like what we're doing as part of that strategy. We're identifying clinic points of contact through our connections with the leadership. We are scheduling meet and greets to meet everybody at each clinic, like going in person and meeting everybody and taking a tour of the facility. And then we're also having monthly planning meetings with each. We're calling it a practice implementation team, just to help coordinate and plan project activities. So by laying this foundation in the pilot, we saw that it was, essential for this to be done in order to use practice facilitation to identify contextual challenges and practices and combine provider and practice level strategies to develop these clinic practice plans that we will get at the end and help enact changes in the practice to improve vaccination rates in the clinics. So for the last slide, I just wanted to show you the face of the people like on the ground, because I think it's important to show the people that we work with at the clinics. So these are some of the photos that we took at the recent meet and greets with CHN. And you can see Heather and Sonia, who are the leads, at the Gulfport Clinic and their staff. And you can see just, how we were there trying to get familiar with everybody, meeting people, seeing how their operations worked on a day-to-day basis, and just showing, trying to establish a good core foundation as we proceed with the intervention. And once again, that's all I have, but thank you so much for your attention, and I'll be happy to answer questions when it's time for the Q&A.
Thank you so much, Dr. Morales-Campos. And now we have Dr. Jesus Saucedo. He is with Trust. It's a community network platform for engaging diverse populations. Welcome, Dr. Saucedo.
Thank you so much. It's a real pleasure, honor to be here with fellow Texans, and thank National Hispanic Health Foundation and EQB Med Ecosystems for sponsoring. By the way of background, like I said, I'm a fellow Texan. I'm a family physician. I also trained in obstetrics and gynecology. I spent quite a bit of time in San Antonio, Texas, former faculty there at the University of Texas Health Science Center. I'm so excited to be here. I've had a long journey in healthcare. I have a background as a clinical informaticist and data scientist. A little background on Trust. Company was founded with a like-minded mission about solving problems in the community. I'm a physician. I see things through the medical perspective. I see patients come in through our doors, through the emergency rooms, through clinics, through urgent cares. And really the history of Trust was during the pandemic, it was really critical to work with community-based organizations, in this case, Promotoras. And that's how the company was created and started, with the idea that healthcare should really be not inside out, should be outside in. And thus why the organization was started, and really proud to be supporting it as a clinical advisor. Next. And what is the Trust? Thank you. Community network platform engaging diverse populations. Next. So why are we here today? It's about clinical trials. Why are clinical trials? It's not because they're slow, it's because 85% white. We know that in order to get diverse populations involved in clinical trials, it takes a lot. So right now, a lot of the work has been done in predominantly Caucasian white communities. We need to have drugs tested on diverse communities for many reasons. Obviously, we're all here because it's a lack of, you want to save lives. I am a practicing physician still. As a gynecologist, I saw a lot of folks who didn't get HPV vaccination and had cervical cancer. So that's why it's so critical to have clinical trials that have folks that look like us who are part of the community. Next. Once again, it's about serving underserved populations, communities that don't participate in clinical trials. And why is that? I'd say the number one reason, I think, is lack of trust. The communities, it's have been predominantly not served. So, working with clinical trials, you need to establish relationships in the community through trust and trusted messengers as well. Also, there's a myriad of other issues, lack of awareness. There's just not enough awareness about the opportunity to have underserved communities, Latino communities involved in participation in medical research. Just creating awareness, the availability of clinical trials, and how their participation helps the community, and really more accurate, inclusive research. As Dr. Morales-Campos noted, it's about developing treatments that are effective for the community. Another issue is lack of the language issue. Language assistance. I'm a physician. Translating complex medical terminology into Spanish or other languages commonly spoken in the community, it really helps ensure participants fully understand trial procedures, and the community supports that, right? If they're able to be involved, and then obviously a lack of needed information and tools. Digital tools is one example, and then obviously we'll be talking about some access. For access, it could be transportation, it could be other issues that are faced in the community. Next. And what does the platform really do? It really supports community-based organizations, the promotoras in the community, and it really leverages their existing relationships. They are the boots on the ground. They are the trusted messengers who have a diverse community, who are trusted in the community, work in the community, and they're what I see as boots on the ground. And again, healthcare is a very inside out, providing information from the community and getting people engaged and activated. So the platform supports creating awareness, communicating about health education, opportunities. It really increases engagement through recruitment, enrolling, engaging patients in the Latino community that can have touch points throughout the clinical trial phases. And also, you have to have an engaged community that also you have to, it's not just about being in a clinical trial, but it's also about having all the necessary support to be part of a clinical trial, but stay in a clinical trial. So closing health, social care gaps is really important. You'll see it in the fact that a lot of the communities, simple screening, as referred back to my colleague, Dr. Morales-Campos, the work that she did at these community clinics is amazing. It's about screening, referring patients to community health centers, to social care providers. Next, please. Thank you. You can hear audio. I'm not sure you could hear audio.
No, we are not able to hear the audio. I'm not
Okay.
sure.
I could speak to it as, and basically, again, the platform is about engaging communities, about giving them the digital tools so they can connect with their community. It's not about Excel sheets. It's about really making sure that they have those digital tools to communicate in a two-way way and help decrease that friction that they may have in their community to getting messages out. We could just skip this. And then what are some of the work that's being done in California? There's been a vast outreach and engagement through digitizing communities. There's over 100 partners, and the partners are from food to transportation to mental health, because we really realize that you have to give those digital tools that support the community health worker, the promotora, so that they have longevity in supporting their communities. Currently, the platform serves 1.9 million, up to 2 million members in California and Georgia, and 85 languages, and almost 35 million SMS communication. But more importantly, it's about providing those digital tools so that the health worker can have outreach, engagement, touch points throughout that journey, whether it's a clinical trial, whether it's food assistance, or just educational pieces to getting people across that line. Thank you.
Thank you so much, Dr. Saucedo. And I have one question. I agree that our community needs more education to be able to understand the clinical trials in order to participate. Thank you very much. There is another, that was a comment. The question is, are you able to send the link of this trust platform?
Oh, absolutely. If you, I could put it in the chat in a minute, or also at the very beginning, there's, I could send it through the webinar through Lillian as well. But at the very beginning, you had my information.
Absolutely. Thank you so much. So that'll be sent through the chat. I have a question for Dr. Morales-Campos. Can we speak about not just the integration of promotoras in recruitment, but what steps can be taken so that it's respectfully implemented? Do you have any takeaways from your research that you can share with us?
I think it's important, well, I guess depending where you're doing your research, in what state, I would investigate to see or what connections you already have, like to reputable. There's usually like already established promotora organizations. Like for my work in the Valley, we worked with the Colonias program. And so there, she's no longer there. It was Laura Trevino, who was my contact there. So she was instrumental just with helping us with the research. And I know like one important factor is like making sure that they're, getting paid like adequately. And so one way we would do that is like we would do like a subcontract in our grants with the Colonias program and just make sure that we, adequately allocated like percent effort, for however many promotoras would be working with us in the intervention. So those are just some of the few things that I've done in my research that has helped.
Thank you so much. And a follow-up question for Dr. Saucedo is with trust. So you currently do work with promotoras and your
Right.
application, and do they can they guide potential participants to research?
Absolutely. Absolutely. Great question. So, again, it's supporting the community of promotoras, right? I mean, because they're basically going back to what I said earlier. I mean, they're the ones who are the trust builders in the community. They're the ones that have the cultural competence and support and education awareness, right? I mean, they're at the front line. They have those relationship building, and it's not just about the clinical trial, but support. They're already supporting efforts, whether it's Medicaid redetermination, whether it's issues around uh, food insecurity. I mean, so they're already there. So they're already part of the community. They already have the foundation, if you will, of being part of the community. Using the platform just elevates that. It's much easier to use when you're able to connect in language and culturally and linguistically. So yes, you can.
I will take that information and pose it to Dr. Morales-Campos with her current research. Were there certain ways of communication aside? I don't know the versions of communication that you used on your research, whether it was face-to-face or whether there was a certain device or technology that was used. But I wondered if you had insight on maybe something that worked best, given your work in rural communities or smaller communities,
Yeah.
I should say.
So for the research that I've done with promotoras, I just want to emphasize it was in like before COVID. So a lot of it was like the traditional mode, like face to face, like having pláticas, going to schools, coming to health fairs and such. So I know times have changed. So different, like more people are more tech savvy now. So I haven't worked with promotoras like post-COVID just to see if there's anything changes like in relation to patient recruitment or recruitment for studies. I know like with our practices, we have also switched. Like we're trying to see like what works best for them. Like before COVID, also they weren't as tech savvy, but now since COVID has happened, so many things have gone like to web-based platforms to do trainings. So we are giving them the option of, we could do in person, or we can do hybrid, or we can do all virtual. So it just depends, like what our collaborators are most interested in. We try to tailor it to what works for them, for their needs.
If I could add on to that, Dr. Morales-Campos, and what we've been seeing in the community is, healthcare should not be between hours of 9 to 5. What we're finding is evening hours are really critical. As a physician practicing, evening hours are really critical, right? We don't have banker hours. And so, but using a technology tool, regardless of what it is, but to do a two-way chat and figure out, hey, what are those needs that you need, right? Is it transportation? Is it childcare? That's so critical to make sure that your community follows up, right? Those touch points that are really important that we're seeing using the platform, and what our promotoras have told us, that's been very successful.
Yes, and
And
I just want to add on, sorry,
no,
just I've seen also that like telemedicine has also been more popular in rural areas, just because sometimes depending like transportation wise or whatnot, or availability of just having like a medical professional nearby to you, they might only be there certain days. That's also been more frequently used in like rural health settings too.
Awesome. I again echo that, because healthcare really should be at someone's home, right, and not the traditional. What I just said about we wait for people to come through the doors of a traditional health system. Going to where the community lives is so important. So telehealth is really critical, and also just as a touch point, right? Just checking in on folks, whether it's through text or whether it's just a two-way communication. But just a quick video visit, 2 minutes, hey, you're okay, is really important.
thank you so much for that. And something that kind of falls in line with both of your comments is that I would like to know from your perspective how we address challenges that, come with digital literacy. Because I know that um, many in our community, specifically those that have maybe a subsidy to receive a mobile to communicate in rural areas, may not have technology, or what technology we can try to bring to the underserved in the Hispanic community. So I just general thoughts on digital literacy and how, if there are any ways that we can curb that to help. I think you're on mute, Dr. Saucedo.
Oh, I wanted to give Dr. Morales-Campos a chance to talk also. So, I mean, digital literacy is so critical, right? And so, but I think you need to step back and look at broadband, right? So if you don't have access to broadband, kids can't get educated. You can't send messages back and forth to your community, right? So that the health literacy also has to include access to broadband, and so that you can have a telehealth visit, phone call, texting, and then that whole critical piece about the awareness, right? So it's language. Language is so critical. I mean, I mentioned earlier about that complex medical terminology, and like how the work that we've done with promotoras, it's really they understand, and can discuss like what to expect for trial procedures, like where to go when you have questions arise, understanding communication. I think, and then again also that cultural nuances, that health beliefs, so that the community is so much more empowered to have the ability to ask questions and feel comfortable asking questions about health. Hopefully that gives you a little bit of an answer.
Yeah, I agree with Dr. Saucedo. Just the promotora is like that critical link, like between the research community and between the researcher and the community. And like even in our research, just having them part of the team, just to like just as an example, like our curriculums. I mean, there's certain nuances just in Spanish, depending like what country you're from. Like we might say it differently here, like up here in Texas, but if some folks are from Mexico, certain words are different. Even like Puerto Ricans have certain words for certain things. So just making sure like we're using the correct medical terms in Spanish, so they understand like what we're saying, like for our cervical cancer education materials was so critical for them to review and give us their input and help us make sure we have the wording correct. And just like, I think another reason why they're so critical is just the trust that the community has with the promotora, especially when it comes to a clinical trial. Just whatever it might be, because it could be for different purposes, like testing of drugs or different procedures, but like explaining like what's gonna happen, making sure they're like in compliance with whatever needs to be done, you know, before they go to whatever appointment they have to go to. So yeah, just having them there as that linkage between the two, I think is very essential.
Thank you so much. So I will,
Also,
oh, go ahead.
no, I mean, what you're describing about community health workers or promotoras is like you know, you have to give them that foundation, whether it's, you know, that educational piece that you just described, that the foundation, whether it's through, you know, building more of technology, but at the end of the day, it's really about giving them a real opportunity to be part of that solution, part of that engagement, to be part of a clinical trial. And have really a you know, ownership of their health. And I think many times, you know, we just don't, you know, we, from the medical perspective, it's, you know, the way we were trained, it's always top down, right? So really have to have that level setting, to have the community be part of that conversation of how they want to be treated, how they want to be participants in clinical trials. And really, you know, really, you hear about precision medicine, right? Like I was in San Antonio talking about diabetes, right? So there's, you know, if you look at diabetes, it's the precursor for many cancers, right? So you have to really engage the community at very early on. And to your work, Dr. Morales-Campos, around HPV, that's so critical because now you're educating that next generation, the importance of vaccinations, the importance about health literacy, about how to take care of their bodies. So, you know, I think that's where, you know, federally qualified health centers do such a great job, right? They're part of the community, they serve the community. And I'm, you know, I used to work in federally qualified health centers, so I, you know, big advocate for them, for all the great work that they do.
Thank you so much. We do have a question for both of you. Hispanic individuals and study participants now more than ever are apprehensive about providing their contact information. How can we clearly and simply explain how we are safeguarding their information? Also, are we obligated to hand over participant information to government agencies, such as ICE? If asked for this, how can we handle this type of situation to best protect our participants? Eh, I will.
I'll try and tackle the handing over participant information to ICE. I mean, as far as I know, it's protected under, like, for my particular study, it's public health information, so PHI. So I don't think we're able to disclose that information unless it's like maybe under through a warrant, or like if it goes to like a trial or something like that. But like if somebody were to come to get, like to me personally, to get the data on a person, I'm not able to disclose that to them because they're not essential people part of the study. That makes sense. So they would be safe under, you know, as part of the research study that they've signed up to be in.
Absolutely. Totally agree with what was just stated. They would have to come through a legal perspective, and not we would not hand it over any information. A lot of our information is cleansed, doesn't have PHI, and so we would not be required to do that, and we wouldn't as a part of the mission.
Thank you so much. One comment, great work that you both are doing. Excited to see the work continue. And any comments about what you predict in light of the current environment?
I mean, as far as with us, because like I'm affected just because of the freeze. I mean, as far as I know as of right now, our research is continuing to move forward until we hear anything definite, you know, from the government. Um, you know, I mean, I'm a, how do you say, advocate of helping the Latino community as part of my research. So I'm going to continue to do my part. I know it's troubling times, but you know, we still move forward, you know, si se puede, as we say.
Absolutely. No, great question. So plain and simple, that's why we need to support promotoras, community health workers, period. Got to continue supporting. The take home message that I want to give is support them so that they can empower their communities, create a network effect, and and essentially, they are the boots on the ground. They're the front line, and so they're the folks that we need to continue to support, whether through digital tools or the work that my colleague is doing, and also going back to the focus of this conversation is about clinical trials. You need diversity in clinical trials. The very first statement I said was, what's the problem with clinical trials? 85% white. So, going back and focusing on that is so important. It's like we need to have, drugs need to be tested on diverse communities, on Latino populations, and be part of the conversation. Because if not, we're going to result in higher deaths, right? I mean, end of point, end of story. I'm a physician. I see patients who have terminal disease that could have been prevented through either vaccines or through interventions with clinical trials, period.
Thank you so much. One comment, thank you for this important work. Glad to see this webinar will be available to others. We'll pass important message to medical students, colleagues, and local organizations committed to serving the Latina community. Thank you so much for that comment. We have a question for Dr. Morales-Campos. What process did you use to engage the FQHCs to be partners in the clinical trial space? Do you think promotores are willing to use technologies to engage?
So for me, from my personal experience, it took a lot of hard work and persistence and also networking and making connections. So for me, one big connection that I made was with the Texas Association of Community Health Centers. Shout out because they're one of the consultants on our grant. And they were very instrumental, specifically Dr. Roxana Cruz, who's the medical director, just putting me in contact with her FQHC contacts. And I just prepared like something very simple, like an email, and just asking if anybody was interested to reach out to me, to participate in the study. And I was able to get, originally it was 4. And just because, just if folks aren't aware, like getting grants is not easy. So it takes a lot of tries. This one took like about 4 or 5 tries to get awarded. So just because it took so long, we were left with 3 FQHCs at the end that were, the collaborators in the final round. But yes, it took I tried at first like a lot of networking individually to get folks to collaborate, and it just didn't pan out that way. But the one that did work out was connecting with TAP and then going through them. And I always thank my collaborators, my partners, because they stuck through me through so many trials of applying. And it's nice, like at the end, like when you're awarded and they're thankful, they're like, well, we knew you could do it, and you were able to get the money now, and now we can actually do what we said we're gonna do. So it's nice when it all pans out at the end.
That's fantastic. Thank you so much. I have two more questions. One is, how are CHWs trained to manage misinformation? Also, we never ask for documentation status in our work. So I will leave it to either of you to answer this question.
Dr. Saucedo, do you want to ask? I can go after you.
Absolutely. So part of it is that education and awareness. You have to work with your promotoras, the community, create and both the provide the education, the benefits and risks of participating, and helping dispel these myths and fears around medical research, and really creating an awareness of an importance of the availability of clinical trials and how their participation helps our community, right? So it's more accurate, inclusive research, and it's really essential in developing treatments. So they're part of dispelling those myths and fears. part of it is having that strong relationship with folks like Dr. Morales-Campos, who are the clinical researchers who are giving them evidence-based information that they can use.
And then from my experience, just working with the promotoras themselves, like in the community setting, when we're doing our research studies, we also want to make sure we try to do like troubleshooting sessions that we meet with the promotoras so we can touch base with them to see like what's going on in the community, what are they hearing from participants, and if there's any questions, because sometimes they don't know all the answers. So that's why we're there to help them figure out like what to say, how to say it, especially with our research topic like HP vaccination. There's a lot of misinformation regarding that. I mean, before, COVID happened and after it got worse. So just making sure there's a contact, with that's up-to-date resources on how to dispel like beliefs related to vaccination. And what we would do is like just little skills building exercises with them, like pretending like trying to be the difficult person so they could just have practice so they know how to answer, with the difficult questions. Because sometimes like when somebody comes up to you, you don't know how to answer and you freeze up. So I know they found that very beneficial, just, having to practice, like if somebody comes up with a difficult response, like how do you respond to them in a healthy way, to show them, this is the benefit, for X, Y, and Z. So I think that also helped to combat misinformation in our studies.
Thank you so much. And last question we have from the audience is that research is not a core competency of CHW training. And I think you answered part of this, Dr. Morales-Campos, is how do you navigate? So I don't know if there is anything else that you would like to add, or you, Dr. Saucedo.
I'll just add, like, it might not be like a core competency, but if it's something that a promotor or promotora is interested in learning more about, because if it'll help their community, I try to figure out if there's ways for you to collaborate, with different researchers. I mean, because there's ways that you could be part of a study and just learn, just learn the skills of the trade. And that would be one way to build your repertoire of skills. I mean, we do it all the time with students, and I see no reason why, there's no way we can open it up to promotores and promotoras that are also interested in learning more about research. I know, like, as a part of our studies, we try to do, well, there's like a city training that researchers are supposed to do to learn more about, oh my gosh, I'm totally blanking, like ethics, how to what is it?
No.
Justice and ethics, and I can't think of it. Yes.
Yeah.
So trying to have a promotora do the city training is just like, it's so high level. So we use a training called the tres training, which is, it breaks it down more easier, gives little scenarios where they can understand, the differences between the different terminologies. And that way they have that background on ethics, especially because they're part of like a research study. So that's one way we help also with the research aspect piece and the ethics piece. When we have collaborators that are promotoras that are helping us with recruitment, or if it's other parts of the research studies.
Also, I just have to add, if promotoras are doing work around Medicaid redetermination, those are complicated forms. So it's not, it's complicated, but at the same time, there are resources they have access to. And again, it's that network effect, right? So they share information amongst each other. I mean, some of the work that we've done in California is really about sharing a library of information on where they can go and get more information, and training information as well. So it's out there. It can be done.
And I will also comment that there are actually Egality Sciences actually does have training for promotoras. Specifically, we have given that training in West Texas and New Mexico and are able to offer it. So I'll just throw that out there. And it's in English and Spanish, and we're working on other languages as well. So without deviating from another, there are a few other questions, and I will read this out. This has been a great opportunity to hear from presenters to what Dr. Saucedo said about the need to increase the representation of our diverse communities amongst research participants. I have heard about CHW's work to become decentralized from large institutions that community members do not already engage with. For example, more on street work, home visits, etc. What tactics could research projects use to increase the diversity of our research participants while understanding that trust from our communities won't come overnight? Or should research projects adopt from current CHW practices? Thank you.
Wow, great question. Whoever that is. Wow, this is so critical, right, to success, and how, again, going back to the whole idea that, healthcare traditionally has to come through the traditional four walls of an institution. I mean, just look at the example of COVID, right? It's like the community health workers are in the community doing the work on the street, whether it's your example about home visits. I mean, connect with me. I'd love to do something around research and supporting your efforts, whoever this person is or persons. And you're right. It doesn't happen overnight. Trust doesn't happen overnight, is your comment. And again, you have to support the promotoras or the community health workers through, a foundation, right? It's like you continue to build on it, whether it's through technology or, leadership that Yvonne and Dr. Morales-Campos is doing. It's like it takes time, right? And so they have to be part of that conversation. But great question. Feel free to reach out to me. Love to hear more.
And just as we near the end of our webinar today, I would just yield the floor to Dr. Saucedo and Dr. Morales-Campos for some final thoughts before we close our session.
Dr. Morales, I'll let you go.
Okay, I was like, who goes first? So just in closing, I just like to say, well, like as part of my mission is just to work closely with the community. And I think that's one essential piece that every researcher tries to do. Whether it's, in the clinical setting, working with, federally qualified health centers, or in the community, working with people that are already linked with the people on the ground. Just to ensure that our research isn't like how we said earlier, like top down. We want to make sure that we're working together as a collaborative and trying to find out, what works, what's feasible, and what can be sustained over time to help improve whatever health outcome that we're looking at.
I'm going to just go back to the original premise of what we started, why we're here about clinical trials. Again, clinical trials, you need diversity. You need diversity. You need diversity in clinical trials, period. It's that lack of diversity really has a impact in the communities. Increased deaths. There's a huge, loss of life, financial, you lose populations that should be still part of the workforce and being part of the community. In the day, it behooves all of us to be really active in the community, because I, as a physician, I see that end cancer patient, and I wish they had access to a lot of the knowledge and the resources that are out there. So that's my takeaway. And thank you.
Well, I'd like to thank everyone for joining us today. I invite you to kindly take this post-webinar survey. This would be extremely useful for future collaborations and topics that we'd like to discuss. So if you can scan the QR code, take the survey, and we look forward to hearing from you and hosting another webinar in the future. But for now, thank you so much for your time. I'd like to just point out the joint accreditation statement and the CME's designation. Please go ahead and send an email to NHHF if we can provide this for you. Thank you so much for your time today. Feel free to, if you're interested in talking more about clinical research, please contact us at NHHF@nhhfx.org. Thank you so much. Have a wonderful evening.